Dear colleagues, my name is Varvara Kitaeva. Together with Alexei Kotov, we would like to present you an abstract on thrombohemorrhagic brain damage in COVID-19 under the guise of Wernicke encephalopathy. Together, we present two clinical cases of thrombohemorrhagic brain lesions in COVID-19 occurring under the guise of Wernicke encephalopathy. Let us have a look at the first case. A 43-year-old patient had a headache in the occipital region. A week later, the body temperature raised up to 38 degrees Celsius. On the 14th day, pneumonia was found. On the 21st day, the blood pressure was 180 over 130 millimeters of mercury. Then it lowered to 100 over 60 millimeters of mercury. Left-sided ptosis, strabismus, ataxia appeared. Diagnosed bilateral pneumonia was caused by SARS-CoV-2. Letters A and B of Figure 1 represent an MRI of the brain made 25 days after the onset of the disease. Then new neurological symptoms appeared. After 2 months, the patient had an episode of weakness in the left arm. Thrombosis of the right transverse sinus was found. You can see it under the letters C and D of Figure 1, where MRI angiography of the brain is presented. Now let us have a look at the second case. 41-year-old patient got colitis, lost sense of smell, then obtundation, bilateral ptosis, dysentery were noted. On the 11th day, the patient had febrile fever. That day, the patient underwent an MRI of the brain, the result of which you can see in Figure 2. MRI revealed a lesion in the left thalamus, a lesion in the right hemisphere of the cerebellum with hemorrhagic impregnation. On the 27th day, pneumonia caused by SARS-CoV-2 was found. 2 months after the onset of the disease, the patient underwent another MRI of the brain, the result of which you can see in Figure 3. After 4 months, the patient had bilateral ptosis, vertical guise palsy, divergent strabismus on the right, bilateral convergence palsy, internuclear ophthalmoplegia, mydriasis, ataxia, hyperactive tendon reflexes in the hands. Obviously, the cerebrovascular disorders in patients were caused by COVID-19. The diagnosed neurological disorders resemble the Wernicke encephalopathy. In conclusion, I would like to say that during the COVID-19 pandemic, doctors need to be alert to all patients with new onset neurological symptoms. This will make it possible to diagnose COVID-19 in a timely manner.